Dear readers, today we are delighted to have with us Dr. David Koivuranta, a renowned chiropractor and health consultant at the Toronto Neck and Back Pain Clinic, and also in time health management. With a passion for improving workplace health and a deep understanding of the interconnectedness of various health factors, Dr. David is here to share his insights and almost 3 decades of long experience on a range of topics from ergonomics to the role of nervous system in health. So without further ado, let's dive into the conversation. Dr. David, welcome.
Hey, Suman, thank you for having me.
So first, Doctor, could you tell us a bit about your journey, meaning what inspired you to become a chiropractor and health consultant? And just before that, in a very short way, just enlighten our readers, what is the service that chiropractor provides? After you.
Yeah, by definition, chiropractor is interested in the health and function of the spine and nervous system, but they do look at the entire skeletal system, so all joints and functioning parts of the body, but they're one of the largest holistic health practitioners in the world as well. So just very interested in helping people stay well without drugs and surgery. So yeah, a good part of people's wellness and lifestyle, but also, 90% of people go to chiropractor for what we're best known for, which is back and neck pain.
And what inspired you for the journey?
Well, I'll share as brief story as I can, because over the years, the story has become more and more relevant, actually. If I look back, in the moment, it may not have seemed quite as intertwined, but looking back, it's quite interesting. There's a few things that came into play, but the most important was in high school and university, I was a competitive middle long distance runner. And in high school, our coach got our running club sponsored by a chiropractor. And the coach said, go. And what the coach said, you did. Yeah. And I went, and a good chiropractor up in Thunder Bay, Ontario, who still practices, Dr. Michael Pastina, wonderful gentleman. He was my first chiropractor, and I had the pleasure of working with him before I moved to Toronto from Thunder Bay. And we went. There was nothing wrong with us. We had no pains or problems, but we went for two reasons. One was to prevent injuries, and the other was to improve performance. So that was my first exposure to chiropractic, not neck or back pain, but actually the lifestyle benefit or component. And then as a patient under his care, I unfortunately had an accident that he really helped me rehabilitate through. So now I learned the value, not only in the wellness, but also when there was a problem, how effective chiropractic could be. But a little bit of backstory, and I'll try to be brief, is that when I was very young in elementary school, I had a lung sickness. I had croup, and they put me in the hospital for a week in a ventilated bed. Oh. And it's one of these things you remember from childhood because it's pretty dramatic. Yeah. And ever after that, whenever I got a cough, a cold, I would tell nobody. I would go home. The doctor had said to my parents, hey, if he gets sick, give him this ventilated mist in his room. I would go home in the basement and hide with this ventilated mist because I didn't want to tell anyone I was sick, because I did not want to go back to a hospital. I did not want to see a doctor. And it just didn't resonate with me. It was not a good experience. It wasn't that I was choosing to live this alternative lifestyle as a child, but I remember thinking, man, this is not, a good way to go. You got to stay healthy to avoid these experiences. So it's funny how those different factors came together. And then fast forward now to university and undergrad, I was an honors chemistry major. And one day I was working in the lab formulating something or another, and I realized, wait a minute, this is what I might be doing for the rest of my life. And I didn't really want to do that for the rest of my life. So I was a little bit downtrodden with that. And that same day, I happened to go for a chiropractic treatment. And the chiropractor could tell something was off. I was in my own head too much. And he asked me what was wrong. And I explained to him the situation with my schooling and where I was headed. And he said to me, you should be a chiropractor. And up until that point, even though all those other things had happened, I'd never thought of it until he mentioned it. And then that was it. He set the ball rolling, and here we are. So I apologize for the long story, but it's kind of interesting how all those factors, person's experience is very valuable in their life. For me in my career and helping people, but everybody kind of has a journey, and it's kind of exciting when we get to share that story. So I appreciate you asking me.
No, it's okay, because after, whenever the things are happening, Sometimes we are living the experience. That moment we do not realize what will be the impact of these experiences in our life. But much later, when you reflect on it, you can connect the dots.
Yeah, very well said.
That's very fascinating. That now you see a pattern in your life. Like you are kind of, that's say, like in a very dramatic way to put it, you are destined in this way. Like
yes, yeah, you can see
life,
how life supports you. You
yeah,
may
life
not see
supports
it.
you.
You may not see it in the moment, but it's happening.
Yeah, like when much later you reflect it, that the same thing happened. I wanted to always in any kind of armed forces, and I became a content creator because of that for so much reason. So like you plan something for yourself, life plans something else for yourself.
That's right.
Yeah.
And somewhere in the mix is the journey, and we just try to have fun while we're doing it.
Definitely, definitely. Otherwise, we wouldn't be doing it. Otherwise, you wouldn't be doing it for this long. Maybe you
Exactly.
will switch to other career because you are having fun, and by having fun in your life, you're helping other people. That is why you're doing it. Fantastic. So good to know. So good to know. So your my second question is also answered in that. So we will unpack the practice a bit so that our readers can understand that what exactly are the benefits of it. So we will start with the ergonomics and posture correction thing and everything. So can you share some of the most common posture mistakes people make in their daily lives and how these can be corrected through ergonomics?
Yeah, it's very timely. Just this week on, I believe it was CTV News on the morning show, they had someone come in and speak to what's being coined as tech neck. And a lot of it is the technology that we've been exposed to now over time and will not cease, but hopefully improves in how we interact with it. So another interesting story with ergonomics is if we go back to the Industrial Revolution, man designed machines to be able to do many of the tasks, especially the hard physical tasks that were hard on the person, that the machines could do it instead. But they soon realized that if the interface between the human and the machine wasn't comfortable, there would still be an impact on the human running the machine. So ergonomics was born out of the necessity that, okay, you can have a machine to make a job easier or better, but the interface still has to be good so it doesn't impact or hurt the worker. And that's kind of where ergonomics was born. And we bring that into modern times. We have these common scenarios still in many physical and labor situations, but the biggest one in an urban setting might be the computer work, of course, and hence the tech neck that we hear about. So it really is, there are a lot of things that can be done to help set up ergonomics better. There are chairs, there are sit-stand stations, there are measurements to make sure your screen is in the right position. But with Time Health Management, our corporate health and wellness company, when we've gone on and done ergonomic assessments, one of the reasons companies have chosen to work with us is that it's not just the analytics and the mechanics, but it's also the emphasis on the individual, that it's their habits and patterns. So we've gone in as an example, and this is not a knock on anyone, this is just a reflection of human nature, that even the executives who have access to the Herman Miller chairs and the beautiful desks and all the equipment, furniture that's available to set it up nicely, but if they're not engaging in it properly, and they're doing it for 6, 8, 10 hours a day, it's still going to be a problem. Yeah. So one of the biggest things we can do is just watch our habits when it comes to using technology, our phones, the tablets, the laptops, the computers. And we just want to do what our parents always told us when we were younger, was to sit tall, stand tall. And if we can recreate that natural, healthy position for our spine, our head and neck when we're engaged in the work we do all day, it'll save us from problems. It'll save us from neck pain, back pain, headaches. It affects our mood. It affects our productivity. It affects the body physiology. It has far-reaching effects. So it's not about the aesthetics. We're all very beautiful the way we are, but it does actually impact the function of the body, especially through the nervous system.
Oh, fantastic. Like our lifestyle as a knowledge worker or as a content creator, from my perspective, our lifestyle is kind of sedentary. So we are sitting in a chair for most of part of our day. So if we are not sitting correctly, we are basically hurting ourselves.
Yeah, that's an accurate statement.
Yeah. So, and basically, even if we have the beautiful, like the standing desk, or there is a folding let's say, a treadmill beneath our table, if we are not using it correctly, again, we are not engaging properly. So that's where ergonomics comes in.
Exactly. Yeah.
Okay.
Case in point, in the last 5 years, and especially through COVID, the sit-stand station became very popular, but there wasn't a lot of research indicating the full impact of it until it was actually researched. And when it first came out, workers would sit until they were stiff or sore, then stand until they were stiff or sore, then sit until they were stiff, and it kind of defeated the purpose of having the intervention. So the research shows that roughly every 30 minutes, a worker should try to sit and stand regardless of how they feel throughout the day to cycle through that. Now, understandably, for me, it's easy to encourage that implementation, but the reality is work, things have to get done, we get caught up. But again, at the end of the day, it just comes down to someone trying to do their best to intervene through that cycle of sit and stand. But the final thing about that is, even with standing, ask anybody who perhaps works retail or is on their feet all day, especially if they're not moving a lot, they still have to move. So before sit stand was popular, it was always necessary from our sedentary repetitive work, whether it's standing or sitting in place, is to move. You got to go for a walk, you got to do some bending, twisting, you got to take a break, and then come back to that work. Yeah.
Oh, fantastic. That basically leads to our next question. It is going in so well, like a so coherent direction. So what are the, like, it's regarding active workplace plans. Like, how can employers implement active workplace plans to enhance the employee health and productivity? Can you share a few successful examples, because you do it a lot?
Yeah. It's such a case-by-case basis, because it depends on a lot of factors and a lot of variables, and it all comes from the top down.
Yeah.
How that business is set up, what kind of service or product they're providing, and who they have working for them, the size of the company. So some of these comments may be higher level or just very generic, but there is a way for every company to strategically implement something for their environment, for their industry, that would make this a reality. Okay. And if you looked at a beehive and the bees, whether they're out collecting the nectar or they're bringing it back and working in the hive, there's a flow. There's a lot of parts moving and everything, and it's done. Like the honey gets made, and it's a beautiful natural system. Many workplaces operate like that at some percentage, meaning that everybody goes to work, and during the day, from a very high level, we would see productivity in every single department, from sales to marketing to IT to administration. We would see that, and yet there's a block or barrier. There's a portion of the flow that gets stopped when we look at the individual worker. There they are, sitting all day, stagnant, stressed, accomplishing the task, but with what kind of productivity and how much impediment to the flow, even though it is flowing, because their natural fit in that system is not one of flow, it's one of resistance. So I hope that makes sense, kind of as an analogy, because that's what we would like to do with an active workplace plan, is make sure that that employee, when he or she comes to work, or they come to work, they fit into there with some kind of flow. They have the ability to come and provide their skill based on what they're educated, trained, and experienced in doing, but allow them to do it in a way where there is no stagnation. They sit, stand, they get up, move around. They're allowed to take their breaks. They're allowed to take a lunch. They have access to some good quality nutrition or snacks. They're encouraged to maybe buy a fitness tracker these days, or something to move as part of their work. And in summary, just imagine if a workplace was designed so that when the employees came there, they weren't squeezed for everything that the employer could get from them, but rather they were nurtured and supported so that the employer could get everything they could from them. That's a very different scenario. And historically in North America, with our culture, I think people have been driven, sometimes by choice or sometimes by duress, to provide that productivity, but it comes at an expense. And that's the biggest expense quite often is our health. And these days, not just our physical, but also our emotional and mental health. But if an environment were set up in that workplace to give that employee a chance to be healthier than when they came, instead of trying to let them be healthy on their own at home, then the outcome, I think, would be very different. So that's what our active workplace plan is designed to do. But we would have to match that. It's very different, say, on an assembly line than it is in a corporate world, in an urban setting, in an office tower. Yeah.
Yeah. As you said in the very beginning, it is very case by case, like very individualistic, very contextual, like whenever it is happening, where it is happening, like what is the sector. Fantastic.
Exactly.
Fantastic. And from that, I understood there is a kind of, as I said in the introduction as well, you see things in a very interconnected way. So next I will go, and it is taken from your blog and your LinkedIn profile and everything, that you focus on 5 factors of health. If focus on nutrition, 1, 2, exercise, 3, sleep, 4, attitude, which is related to stress, and 5 is nervous system function. So how do you see interconnect? Because I have never heard, we talk to a lot of doctors, I have never heard that seeing overall health in this context and in this interconnected of these 5 factors. Can you explain a bit for our readers, please?
For sure. I think fundamentally, as a living organism, there are some things that are inherent as a requirement for our ability to come and experience and have a good life.
Yeah.
And in these factors are some of those important key fundamentals.
Yeah.
We just don't always acknowledge them every day. And because we weren't born with a manual, we rely on, at first, our environment to support us, and our perspective on health is one from parents, family, friends, immediate environment, but it's not always accurate. It's just duplicated, replicated, and it's what we call a familial inheritance. It's not necessarily genetic, but we do typically what we see other people doing, and we learn to operate in a fashion that we've been taught by those surroundings, but it's not always the best way, right? But some of it is fundamental. We do need to eat, because if you try not eating or you don't eat well, we know most of us have the knowledge of the understanding of the implications of that. If you've ever tried to stay up for too long or get too little sleep, it doesn't take much to understand or feel the implications of that. One of the things that maybe we enjoy doing the least, but we also know is an important factor, is our fitness. We've been told from many different angles that this activity component is valuable in our life. The sleep, which one did I'm already missing? And the nervous system is the final one, but I'm missing one. Remember, function, food, fitness. And finances in there, I think. And that's because one of the biggest stressors, especially in North American culture, is finances. And our ability to support ourselves comes down to how we approach our finances and not be stressed or worried about it, but also know what to do with them. And as an investment, not just the money, but also our time. And both of those are valuable when it comes to our health. Yeah. And then the last thing that coordinates that all is the nervous system. So very basically, your body has 3 very, very fundamental requirements. It needs air, it needs food, and it needs water. And it needs clean, natural sources of that, not processed, not refined, not man-made, but nature-made. So again, that's a whole other podcast, a whole other conversation. And most of us understand that.
We will have it in future.
Yeah, that's right. And I'm sure you'll have some really good guests to cover it. And it's good because people want to be reminded, because we are distracted by what's available in our society. That's not good for us. Sometimes okay, because we want to be happy and experience these different things, but it's just when we consume or have exposure to too much that our nutrition goes downhill. But the interesting thing is the activity or the fitness. So when we speak about activity or fitness, sometimes people always think about gym and muscles and having a certain look, and all of that is secondary. None of that is primary. There's 2 primary concerns with activity and fitness. One of them is functional. And what that means is the person who retains function of all their body parts throughout a lifetime, their muscles, their joints, their heart, their lungs, their liver, their gallbladder, their spleen, their intestines, the person who retains the best function of those parts is going to have the best quality of life and probably also live the longest.
Absolutely.
So that's a fundamental. right? And movement is life for all of those parts, not just our muscles and joints, but all our organs, glands, and blood vessels. They rely on movement and motion to support them. So that's one fundamental of the activity. And these stagnant, repetitive, sedentary jobs that we do don't support that. So we need to balance that out in our life, because if we don't, we start to fall behind, and sickness is the result. One of the sources of sickness. There are multiple, but this is a big one, especially in North American urban settings. The other important fundamental of activity, though, and that's why it doesn't have to be hard, it doesn't have to be the gym, it just needs to be going out enjoying some kind of movement, which we're designed to do, is that air, water, and food that we talked about earlier for our nutrition. It has to get into our tissues. It has to get into the cellular level. And then as a byproduct of our tissues using those healthy things, we create waste. We're like a machine, an automobile engine. You put in gas and air, and you get carbon monoxide and water dripping out of the exhaust. Well, we're no different. We also have waste. And in order to drive that waste out of our cells and our tissues and get those toxins out, we have to force it through the system. And that's what activity does. It gets our lungs breathing firmly, it gets the circulation going, and it gets the air, water, and food into the cells and the waste out. So now we're eating well, now we're moving, and when we get enough sleep, our body has a good environment to do some healing on a daily basis. So all day long we use our body, some good stress, some bad stress, some physical, some sedentary, some mental, and then we got to get ready to do it again the next day. And the only way your body's going to be able to do that is take that air, water, and food that we've now pushed in and out of the cells, and then get some sleep. Because all the healing and regulatory function happens when we're sleeping. So those three in a life cycle for a human being are fundamental, non-negotiable, and very valuable. And most of us know this. It's just that in human nature, we get a choice. And everybody's journey is different in terms of those choices. Yeah, and then your investment in time and money, no matter how much time or money you have, some people have more money than time, some people have more time than money, some people have equal time and money. Some of that has to be spent, time and money, on those three fundamentals. And then the thing that coordinates all of it, our behavior, our choices, on the cellular level, is your nervous system. And a healthy functioning nervous system will support you better than any other system in the body, better than the circulatory system, better than the muscular, better than the digestive. They're all important. They all need to work well, but the primary system is your nervous system. So I apologize, that was a long explanation, but I think fundamentally in healthcare, that conversation is something that our young people need to get exposed to early on, so we can erase some of the programming that might not be accurate from our environments, so those young people can start making choices or decisions that are different than maybe what they might get exposed to, so they can set themselves on a better path to health and wellness and change the negative trend that's happening in our society. Because even though we have the knowledge, and even though we have all the science and technology, the fact is, the statistics show heart disease, cancer, diabetes, they're all headed in the wrong direction still. And it may be because you and I are not having this conversation with enough people.
Yeah, I'm already having a paradigm shift, because health and wellness, whenever we look at it from a certain lens. But whenever you move that lens and you are conversating in a very simplistic manner, in a very easily accessible terms, and it sounds so logical. Like, yeah, how could not I sense that? Even after reading all those medical journals and everything, how could not I sense that? Because personally, we are the editors, we're the content creators, so we are not exactly from the medical field, but we talk with lots of medical people. But this type of conversation, yeah, you're absolutely right, we should have this, and specifically for the youngsters, because their life is going like in a direction that should be in a right direction. And yeah, functionality, I never thought it like that. Like, even our internal organs that needs like cleaning, that needs a flow. Fantastic.
Yeah, good.
So no, I'm as I said, I'm experiencing a paradigm shift for myself as well. So
the thing about that, Suman, is it gets boring after a while. And we, as human beings, there's something called the shiny object syndrome.
Yeah.
So someone comes up with some other concept that is some kind of shortcut to a result, or do this instead, or well, we found this minute fact in the science that maybe what we've been doing is wrong. Well, no, like you can major in the minors and distract people for whatever reason or purpose, but these fundamentals, they don't change. And if someone wants to see results, it doesn't take much, but it's boring. It's actually pretty boring. If someone repeated this conversation and they heard the same information, they'd be like, yeah, I know all that, I've heard it. Yeah. But the implementation is weak. So that's why the workplaces, can you imagine if someone who owned or operated that business decided, wow, I get this. I want my employees to have this. How can I create a workplace where they come and do their best to support our business, but at the same time, I give back to them in a very simple way, just providing them an opportunity to be their best through their health. And I think that would be, because someone's got to be on us. Someone's always, like our parents, they were always on us. Yeah. Someone's got to be on us, right?
Yeah. And does it happen in the dieting industry a lot, like shiny new object syndrome?
Well, what do you want to do this week?
No offense to anyone, by the way.
You want to, yeah. And then we're just having a conversation. None of this is right or wrong. And again, It is a case-by-case basis. If someone has a health problem, some of these strategies are very beneficial because they need to make some serious changes. Yeah. But then the sustainability of some of these things is not realistic because it's not natural. You just need to eat well, not eat. So, this week you have the option of fasting. Maybe you'll try fasting, or maybe you'll do protein, paleo diet. Maybe you'll do keto. Every year, every season, the nutrition textbooks are probably the ones that change the most because the research, as it says, ongoing, and they find new things, and then all these different strategies and concepts, and they all have merit and value. If you took someone who was not eating well, had no concept of good diet or nutrition, and you put them on any one of these plans, well, they're going to do well because it's better than what they were already doing. But you could also just put them on a reasonable, natural, what we've known for centuries kind of diet, and they would also do well because it steers them away from the bad thing that they've probably been doing. But I don't know that there's too many people who are eating well and then suffering problems because of it. There would be something else going on that needs to be addressed that's not nutritional, right? Yeah. So a couple of the most researched diets in the world are the Mediterranean diet, a very good model to follow. And then low glycemic load or low glycemic index diet, which just helps eat foods in combinations where it keeps the blood sugar stable. But a Mediterranean diet, that's, if you mentioned the blog earlier, that's one of the key things that's mentioned in our blog, that if people follow the Mediterranean diet, they increase the likelihood of having better nutrition.
Like as it is tried and tested over centuries.
Correct. Yeah. Fundamental.
So, yeah. So, like, as some of our school teachers sometimes say, or maybe some of our parents say that as well, go to the basics.
Go to the basics. Yeah. You can't figure out that differential equation unless you know how to add, subtract, multiply, and divide.
Yes. So go to the basics, and we just tried and tested over the time. Maybe the basics are boring, but basics are fundamental.
Yes.
Yeah. That's how I understood you.
Maybe as another analogy, even the athletes, professional athletes know that there are complicated drills, there are complicated plans, like strategies. But at the same time, unless you're got the fundamentals, it's very hard to implement at that higher level.
Yeah, true.
But let's take that and put it back in the workplace. Now you're an employer, a company, and you're hiring people to come on to be that athlete, and yet you're not providing them the fundamentals of giving you what you're asking them to give you. It's a conflict of interest. Yeah. If I could quickly, with ergonomics, if someone worked in a factory or a warehouse and they drove a forklift, they would have to be licensed certified on the use of that forklift.
Yes.
In most environments.
Yes.
But you could be hired to do marketing, advertising, IT, admin on a computer. And as long as you know how to do the tasks that they're asking you to do, you don't need to be licensed or certified on how do you sit at a computer. But I think people should. That's one of the biggest things that could happen, is that when someone gets hired, they have to show their employer, a manager or supervisor, that they understand the basics of ergonomics at the computer. If they don't, then they need to take training in a course before they start work for that employer on the proper ergonomic setup at a desktop, a laptop, on their phone. And then at some frequency, quarterly, annually, get not only their performance review on what they're supposed to be doing in terms of why they're hired, but also performance review on that ergonomics. I think that would make a huge dent on some of the side effects that are happening, especially in the computer world in the workplace.
Yeah, no wonder, no wonder. One of my previous managers used to say, if you're working in a corporate sector and if you're not taking care of your health, you're burning the candles from both the sides.
Yeah, very well said.
You're burning the candles from both the sides. I liked it. And that's why one of the reasons that I started this, because by doing this, I'll be aware and I'll be come across with experts that are like, even our whole team, they're very much into it. So what is the conversation that is going? It is very related, like that is a natural extension of this conversation is like, how do you see, like in a very briefly, you have covered, I think, enough ground on that, but very briefly for our readers, because this is one of the questions we get so far very often, that what are the fitness plans and wet management program that you see? Like, what is your perspective on that? How do you want to implement it?
So for fitness, the research shows that, you know, if you enjoy or like going to the gym and pushing plates and grinding it out, then good, do it. But many people who have those memberships are there because they know they should be, but they're not enjoying it. And the research actually shows that if those people instead went out, did an activity, badminton, volleyball, swimming, cycling, ultimate frisbee, soccer, and they kept at that regularly throughout their life, and maybe one isn't enough because you're not going to play every day, but maybe if you did 2 or 3, and one of them could just be walking, and then maybe once or twice a week you play soccer, and then the third time maybe you go for a swim. But if we were able to create, and it would help if people enjoy doing those things. So that's what I wish for people, is if they could find something that they really love doing, so that at the end of the day, when they come home, it's been a hard one, something's happened, and now it's evening and they have a few hours. What am I going to do at that time? I got to go back to work tomorrow. I'm just going to rest and, you know, eat, watch TV. Or, oh man, I really love playing. I'm going to go out to the courts and play tennis or badminton because I enjoy that. That is a better scenario in that evening than thing. Yeah. I think it's hard for people to choose going to the gym that evening unless they sincerely love the gym. So that's my hope for people, is that they would find something activity-based that they love to do, so that there's minimal resistance going to do it no matter how we feel, because they enjoy doing it. It really, yeah. And then with weight loss, oh yeah, weight loss that's why it's such a big industry, and because weight loss, it's much easier to put on than it is to put off. People come into the clinic and they say, hey, Dr. Dave, I lost 10 pounds, I lost 20 pounds. I say, hey, if you ever want me to help you find those 10 or 20 pounds, I'll help you do that, no problem. Because it's much easier to put that weight back on. I just say it jokingly, because I'm kind of in a sarcastic way congratulating them, because it's not easy to do. Yeah. But I think it does come down to those two factors, and it does not need to be complicated. But when it gets complicated is if that person already has a health challenge or problem medically, that they may need a specific strategy that will help make some changes in their body that will make the weight loss easier. Yeah. And, you know, the naturopathic profession is very good at helping people identify those blocks or barriers and help them work through it without drug. Yeah. But short of that, I think it's almost as easy, as long as you're persistent and consistent and you're patient. 1 pound a week, maybe even half a pound a week. But if it took 5 years, who cares? Yeah. You know, just stay active and get on that Mediterranean diet. Only eat good stuff. Don't buy processed, refined foods. Treat yourself on occasion. You got to have fun and enjoy life. Don't try to be so strict that you also can enjoy a little treat now and then. And if you can find moderation or balance in that routine, most people will see progress, and that's what people need to see so they can stick with it, is the progress. Okay. Like you have mentioned it twice. So for our readers, in a very brief way, can you just explain Mediterranean diet a bit, like for our readers, what they can do? Yeah. Well, Mediterranean diet basically stays away from processed and refined foods. It's mostly clean sources of protein, all vegetables and fruit, and then natural grains and fibers. And then some healthy oils. Like Mediterranean, they use a lot of olive oil, extra virgin olive oil. But they stay away from safflower, sunflower, corn, canola oil. All these oils that are processed and refined are just not good for us. And so there's nothing miraculous there, I don't think. They, they even consume a little bit of wine, seems to be okay. And even some of the, there's some intricacies with this that once you go down the rabbit hole, there's some debate or some argument. But believe it or not, it seems like genetically or modified grains in North America are exposure in North America to people here seems to excite their immune system, and we have some reaction to that. But when you go to Europe and you consume the same foods without those genetically modified plants, people seem to be able to consume them and have no reaction. So yeah, it's very interesting that someone could go on vacation and have a loaf of white bread in France, or and not feel upset like they would in North America. So there's something going on there. There's some intricacies that go into the details or the specifics of it. But in North America, they say to shop the perimeter of the grocery store, and that's where you find all your fruits, vegetables, meats, dairy. And as long as you're not buying something from the shelves that will last longer on a shelf than you can live, then you're going to be okay.
Oh, like what the food is have a very low shelf life. Those foods are good for health. Kind of that?
Yeah, in that sense, yes. Yeah. So if someone yeah, exactly that. That if that food is processed and refined, so it has a long shelf life and you consume it, it probably has something in it that's not good for you.
Preservatives and all.
Exactly.
Yeah. Okay. And lastly, you have touched this point very briefly earlier, and we would like to stress on that. So, how do you see that financial stress? Because we are kind of in a situation, economic situation that is not well over the world. Like it's not a, we are not in criticism of anything, but it is not well for many of us. So how this financial stress, because stress is one of the 5 factors that you talk about. So how do you see the connection between financial stress and health, and what people can do?
Yeah. So certainly I'm not a financial expert, and with finances, I don't necessarily mean what someone should do with their finances, what they can do to improve their ability to acquire those finances, although there are probably some strategies for that people could talk to somebody about. But I think with whatever someone has available now, and in order to start making a shift for the better, they want to sit down and ask themselves, what can I do with my existing finances? Where can I put that money to get the best return in my life? And if it's not money, then it's time. Somewhere in there, I either have to take the time that I have or make some time somehow so that I can use that time to leverage something to also give me a great return in life. So for example, with the finances, sometimes when we buy our groceries, it seems that the debate is that those things that aren't as good for us are less expensive than the things that are good for us. That's true to some extent, but also not accurate. There are some things we spend our money on in terms of what we consume that we should not even bother consuming, and we should put money more into some healthy things, regardless of our economic status. There is a strategy for that. I'm not saying that it's easy, but you have to start, because once you start, you can build some momentum. And your biggest investment, where you can put your money, is not just the stock market. It's not in owning equity or a home, but into your health. Because the healthier you are, the better your mood, your energy, the better you can not have to feel pain in your body that distracts you from what you want to do every day, the better you're going to be able to accomplish what you want to accomplish with your time and your finances, and even in acquiring those finances. And the same goes with your health. There's nowhere else better to spend time than making sure that you're taking care of yourself. And that means, going out and being active. That means adding 1 or 2 more hours to your sleep. You can take that time, leverage it, get an exponential in return by putting it into yourself, so that every day you wake up prepared to take on whatever you need to take on. Now, that might seem trite, that might seem like it's a purple sky concept that's kind of like mooey wooey, but that's exactly how it works. 100%, that's exactly how it works.
Absolutely, absolutely. I can't agree more. And like, we will wrap up with this with one question that I always try to understand. So a person like you who has huge experience in the field and who have seen almost every type of health issues in your sector and everything, what is your vision? What is your dream that you want to accomplish whenever you are reaching at the very peak? You are still you're still at a very peak of your career, but at the end of every journey has an end. So at the end of your journey, that okay, if I accomplish this, if I see this change in the society, if I see this change in human healthy lifestyle, I will feel very satisfied and proud that I could contribute some to that. What is that vision?
So the vision is that people got exposed to something I was able to share with them that empowered them to realize they were in control of that better outcome or experience in their life, especially through their health. So quite often the neck pain, back pain, someone comes in, they've heard chiropractic can help. They're not really into it. They've tried everything else. We're the practitioner of last resort. They come in and we treat them with a traditional chiropractic treatment, which is very gentle, safe, and effective. There's a lot of misconceptions about chiropractic care and the safety or how aggressive it is. And there's a lot of deviation now to different technology, but I practice traditional chiropractic, hands-on, and it's amazing how people suddenly realize that, wow, something so simple and so directed and focused can make them feel so much better. But here's the kicker. When they come in for that neck or back pain, patients start to realize that once they've decreased and eliminated the neck or back pain, suddenly they say to me, you know what? I'm not getting those headaches anymore. I'm sleeping better. I feel like I have more energy. My digestion problem went away. I'm breathing easier. Yeah. And it's just that's icing on the cake of dealing with their neck or back pain. Yeah. So my vision is that if I told somebody, along with those chiropractic treatments, that maybe you should try this supplement, or maybe you should, what do you enjoy doing most in terms of activity? Why don't you just try to do that 1 day a week now, or 2 days? And they start these things because I encourage them, and it has nothing to do, I'm not special. There are many people out there doing what I do, but my hope and my vision is that for every interaction I have, someone gets empowered to realize that simple choice and that engagement that they decide to do, maybe because I encourage them, it could turn their whole life around. And that's exciting.
Empowering healthy lifestyle for people.
Yes.
Empowering healthy lifestyle for people. That's how I understood it. Fantastic.
Yeah. And I think your website and what your team is doing is vital to that process, because so much information is out there and it's available. Some of it is not accurate and good. And it's great that there's a platform like this that brings together so many different concepts in terms of health, wellness, lifestyle, occupation, that people can access now. And thanks to you and your team, can also be encouraged and empowered to head in that good direction. So that's amazing.
Thank you. Thank you so much for your kind words and everything. With that note, dear readers, we are ending maybe one of our many podcasts with Dr. David. We will have him. We are already enjoying, our whole team is enjoying the conversation. Maybe we will be having another conversation there are so many things to unpack, so many areas we have just touched today. Maybe we will unpack this in the coming times. Thank you for reading this. Thank you for listening this in whatever medium you enjoy. Thank you very much. Thank you.